Okay, so start off, my interviewee is coming to my house. Her name is Kathy Martin, and she's a nurse educator. Do you think luck or hard work made you
Oh,
successful?
it's absolutely hard work. If you want to be a nurse, you have to be dedicated to the mission and be passionate about that work because you're dealing with people 24/7. And I am now a nurse educator, so I have to train the new nurses to be the best, compassionate, um, consistently excellent communicators that they can be with patients who are very demanding, much different from the kind of nurse that was expected of us when I graduated from nursing school like 37 years ago.
Wow. What do you find interesting about your job?
What I find interesting about my job in particular is that I can do so many different things. I also work with the affiliated schools at Providence Tarzana, which means that I have on average approximately 500 students from 15 schools come every 6 months, putting in tens of thousands of hours in it annually. And they all come through me, and I give them background clearance and then place them. So I have students who are externs, and students who are interns, and students who are nurses, and some who are rabbinical students. Because in my job as educator, I service all of the hospital, not only just the nurses, but I also work with the ancillary departments that serve to support nursing.
Wow, that's interesting.
Uh-huh.
How many years have you been doing your job?
The job that I have currently, I've been in for 5.5 years. And before that, I was working in education also for approximately 6 years.
Oh.
So as an educator, I've been an educator for about 11 years, or 1/3 of my career as a nurse.
How did you get into this line of work?
I got into this line of work because at an early age, I worked in a nursing home as a nurse's aide. And when I went back to school to get my college degree, it seemed reasonable that that was the area where I had the most job experience. Mm-hmm. So I went to school to become a nurse, to be able to get the kind of pay that a professional can acquire versus a nurse's aide. Mm-hmm. And I wanted to change to become a professional rather than. I see a nurse's aide as not that we aren't all serving others in different ways. A professional stands apart in the crowd of, basically in the community.
Mm-hmm. What college did you go to?
I actually have 5 college degrees. I graduated in nursing from Pasadena City College, and then I got a degree in business from College of the Canyons, and I got a degree in Bible from Lagos Bible School, and I got a degree as a bachelor's in health education from CSUN, and then I got my master's in nursing education at Mount St. Mary's College in Los Angeles.
A lot of school.
I know. Good question.
Did you have to take any risks during your working career?
I did have to take risks. What kind of risk were you thinking about when you think about risks in
Like
nursing?
something that could bring your job at risk, or
Well, okay, such as confronting a physician.
Yeah. Mm-hmm.
I had to do that, definitely. Because as a nurse, you're the advocate for the patient at all times when you're at work. Mm-hmm. And even, I guess, when you're out of work, too. Because you think about this patient, so when you go home, it's not the kind of a job that you just walk away from and go home and do your washing and dishes, and you don't think about the people that you cared for the time before that. But when I was working at the bedside in intensive care unit, I had a situation where I had to call a doctor because we'd done everything we could. It was a post-op patient, and they needed help. They needed the physician's attention, and I had to call the doctor and be very demanding about him returning to the bedside to help the patient. And that was a risky move, but you do that, you have to make that decision that you're going to do that because you're the patient advocate.
That's scary. It's for the good of the people.
Absolutely.
Mm-hmm. Are you happy with your career?
Yes, I am. I'm more happy than I've ever been because now as an educator, I can broaden into so many different areas. So as I work with the brand new nurses who come, I have work with students, and then when they graduate, they come back to me because I also run the new grad program, or we call it the nurse residency program at Providence, Tarzana. So all the new nurses, I train them and help them get started on their nursing career and ensure a safe path for better patient care.
Wow, that's great.
Yeah, it is kind of fun. So I have a variety of jobs that I do. So every day is different, but every day I have different types of customers contacting me, whether it be a new school or another student or somebody who needs an externship or an internship or wants to volunteer so they can get their foot in the door. Because right now there happens to be a glut of nurses who are graduating and they don't all have positions that are open for them.
You must meet a lot of new people too.
I do all the time. Yeah. And people are really appreciative too because they're starting their careers or stepping into their future as students.
That makes sense. When did you realize this would be your career?
I realized that when I decided to go back to college, and
It just hit you.
Right.
What is a normal work day for you?
A normal work day is that I get up really early because I have to fight an hour and a half of traffic to get to work, bumper to bumper. And then I start work at 7:30 and I pick up all my messages. I usually get about 15 to start the day, but in any given day I can get perhaps about 100 emails from different people in different departments. Sometimes they might want numbers because I also delegate, give out numbers for badges or for clearance for blood glucose monitoring, different unusual things like that. And then depending on if I'm teaching, like I teach ACLS or BLS, so I'll prepare the classroom and let's say it's a day I'm teaching ACLS with my colleague Patty Kagan, then I will prepare the room for the students who are coming, set up the audiovisual, make sure that we have the mannequins ready and the handouts prepared, the materials prepared for them, then teach the class and teach them how to do advanced cardiac life support.
Wow.
And that class is based on American Heart Association standards, and that will be basically to the end of my day because last thing we do before we go home, we usually pass the students. If it's a recertification class, it's just a one-day class. So we wrap it up with a written test after they do what we call a mega code, where just like you might be familiar with the disaster drills that your aunt puts on. Well, yes. We put on a mega code, which is a situation where the victim's dying. Let's say we put out a scenario together where students are bringing in a guy from a party and he's a diabetic and he's non-responsive, and they dump him off and then they leave from the emergency department. And so the nurses that I'm training advanced cardiac life support to, they have to figure out, well, what am I going to do to assess the patient? So right away they're in a drill, which is we call a mega code.
Wow.
And so they have to help that victim survive. And we have a heart monitor that will put them into different rhythms. And they have to attempt the correct medical interventions in order to save the life, whether it's a drug, whether it's CPR, whether it's ordering the correct labs, things like that.
Very important.
Really. But nurses need to be drilled. If you're working in a critical care area, we have to have annual, or in the case of ACLS, every other year they have to be recertified to be sure that they do a great job.
That would be important because
you don't want the patient dying at the bedside.
Exactly.
Right.
Would you rather rely on luck or hard work to be successful?
I think I would rather rely on hard work to be successful, because if you rely on luck, luck can change with the wind. And I'll be honest, I buy lottery tickets. I bought 3 this week, one for each one of the lotteries. I actually never win, But relying on that kind of luck, it can come or it will never come. And also, but when you dedicate yourself and put in a hard day's work, you know that you have the fruit of your labor.
Mm-hmm.
And so it's really important to decide early on that you want what you want and go towards it. And maybe your path will change. I never knew that I would be a nurse educator when I became a nurse. I thought I would be at the bedside nursing for all of my nursing career. But as I grew and changed, and life events changed the paths that I took in life, then I ended up being a nurse educator. And I'm really glad because now I have the idealism and the ability to create research and projects that will um, advance evidence-based practice, which is what we want in the 21st century. We want
Yes.
everything that we do based on great evidence. And that's not about luck. That's about hard work, research, dedication. You've got to have those, or you can't really progress in any career, I don't think, because today's economy is really, really hard. You're entering a field where we never anticipated this. I'm one of those baby boomers way back when. We never thought about getting old, but now we realize that we've, because of the transitions that we've gone through, that we see the transitions that are ahead for you, and there's such much greater demand upon you as an individual to be a perfect professional in everything that you do in your approach to your tasks that you're given, whether they're big or small, that you don't have a chance not to do great things because it's the person who does the great things who's going to be hired versus the person who just thinks, I can go to work and get money and go home. And I want to be a nurse because there's great money in nursing. Yeah, there's money in nursing, but it's a lot of hard work. And if you want to be a nurse who's going to stand the test of time, you have to be dedicated to giving yourself to hard work and research. It's never about luck.
A lot of passion into it.
Really. The only luck I can think about only happens if perhaps you know someone who helps you get a job.
Mm-hmm. There's small things small parts of luck that have to do with it, but it's mainly hard work.
Yes.
Do you feel successful with your job?
I feel very successful with my job, and that's based on the feedback from the people that I serve, that I see lives changed, and I see nursing students who first they're nursing students, then they come to me to be a new nurse. And in the interview I say, sometimes you just don't know what you don't know until you've gone through the situation. And these same nurses will come back to me a year later. She said, I thought I knew everything about emergency nursing. You were so right. I had no idea. I didn't know what I didn't know. And it's kind of like, yeah, I'm the mother hen, and I can see it, but, or maybe you think, or maybe your mom's even that way, that she gives you advice and you think, well, I don't want to listen to her. I'm going to go down this path.
And she's right.
But she's right. She's lived the story. She's gone down the path. She's gone through the misery or whatever.
Just takes your own experience.
But it takes experience of hard knocks, or it's experience. You know, through your failures, you're going to learn the most. But if you don't get out there and try, if you think that life is based on luck and it's just going to come your way and you hold your breath waiting for that balloon to pass by, you're never going to get what you want.
Well, thank you so much. You're so great.
Great.
I learned a lot.
Well, thank you. Sure, you don't have any other questions?
No, I think you about covered it.
Okay, great.
Thank you.
So now you have to tell me how you did it.